My patient is asking for an exaggerated bill for me. For example, he got a treatment done for 10,000. He's asking me for a bill of rupees 15,000. What should I do? If I refuse, the patient will go away. If I say, yes, I am not ethical, I am unethical, I am not being correct, what should I do? The dilemma continues. Hi, I'm Dr. Bhavdeep Ahuja. I'm a dentist with 23 plus years of experience, and along with dentistry, I'm training and coaching colleagues on the topics of practice management, medical legal ethics, consent, documentation, and finance and dentistry. So in this video of mine, I will be divulging a bit about this aspect. Now, where does this question come from? I had a recent online webinar. Recently, I had an online webinar with the orthodontists of India under the Indian Orthodontic Society. And there was one question which again caught my attention. The question I just told you before my introduction. So patients sometimes ask for bills as it is reimbursed by their company. But if I usually refuse if they ask for an exaggerated bill and I end up losing the patient. Your take on that? The first thing is I would like to explain it that we always set the context before we start the treatment. We have to tell the pros and the cons and everything, the RBOs, the risks, benefit and options, and of course the treatment costing and the other precautions and whatever is involved pertaining to the patient to that treatment. Now, if the patient is willing to go ahead with that after weighing all the pros and the cons, so I'm not taking generally orthodontist opinion in that. I'm just taking every dentist, you can say, case presentation or planning in this. So if you come across a case where you have done all the kind of detailing that I just told you, and the patient says a yes, and the total budget, let's suppose, is 25,000. The patient says, I'll get reimbursed only 75%. So kindly give me an enhanced bill of 25,000 or 25%. Roughly, you can say, so that my expenditure is close to, you can say, is my expenditure is totally met, or it is my spending cost is totally equivalent to that. Which would mean, what would this mean? You would be giving a bill which is close to 36,000. 1/4 of that gone, 9,000 gone, and roughly you are left with 27, 26, 27. So close to that. So in that range. So by doing, the patient has actually paid you 25,000 just to please that patient. You are trying to go ahead with that part. Now, it's not only the question of being ethical or unethical in this aspect. There are multiple aspects in this. Number one, when you decide to compromise, you of course become unethical in that. Number two, you fall in your stature in patient's eyes. He is ready to compromise in whatever way. He is amenable to bargaining. He is amenable to so many other things. Number three, the most vital point, when you add that value in your books, which means you have issued a bill for 35, 36, 37, whatever thousand, roughly close to that, you have actually got 25. So you are actually inflating your income by 10 to 12,000, on which you will be paying an income tax of the income which you have not received. Of course, expenses will be deducted, other things, but you will be still paying some amount of income tax over the amount which you have not yet received. You will never receive, not yet, you will never receive that amount. So just to please that patient, you say a no. You say a yes. So the answer is yes, you should openly refuse it. Now, having said that, if the patient has weighed all the pros and the cons and has chosen you as his primary dentist, he or she will never compromise on the treatment pertaining to the bill part or vis-a-vis the bill part. ये डॉक्टर अच्छा है लेकिन ये बिल पूरा नहीं दे रहा, तो let's go to another doctor. वो चाहे डॉक्टर ठीक ठाक हो, and but he'll give us the inflated bill as we want. So if the doctor might be good, but he's not giving us an inflated bill, so let's go to another doctor who is not so competent, not so good, or not, we were not very impressed by his talk, but he's ready to give us an inflated bill. Just translating for my colleagues who are from the southern part of India, for those who don't understand Hindi. So that is what I mean to understand, mean to put across you, that patients never choose you whether you are going to give them bill or not. Bill is a necessary thing. Nobody wants to take a risk with their health, with their life. So they will always weigh the other parts, the doctor's skills, the facilities available, the explanation of the, you can say, side effects or the longevity of the treatment, the RBOs, the risk benefit and options, and the other, you can say, details pertaining to that treatment. No person on this planet would choose other person just because he's giving an inflated bill. Those who go against that and pick other person are not impressed with the other parts that you have done. The doctor didn't explain us. We didn't find him that competent. We didn't find him that good. We didn't find him up to our liking. So plus he was not giving us a bill as we wanted. So we shifted to, sorry, to someone else. Nobody would change you only for the bill. I hope you got the answer. So people don't take risk with their health. Patient को डर लगता है, they are losing out on a good doctor. The patient fears when they lose out on a good doctor because ethically correct and professionally competent people are found very, very rare these days, courtesy the broken system of our education. Can't do anything about it, but yes, whatever I can do, I'm doing my bit to explain my community about these aspects of DMF, documentation management and finance, which is lacking in our education system. So if you found value in this video, please do share with friends and colleagues, and I hope to see you in another video of mine very, very soon, next Wednesday. Till then, bye-bye. Take care, take good care of your health, and God bless.